Wrapping up this Saturday morning of Sports Medicine Weekly here on 670 The Score against Steve Cashel, your Bulls radio host, with Dr. Greg Nicholson, one of the Bulls and White Sox team doctors from Midwest Orthopaedics at Rush, subbing again this week for Dr. Brian Cole. Time now for our Ask the Doctor segment here on Sports Medicine Weekly. We give listeners the opportunity to have our doctors address their specific sports injury issues. You can do it by sending your questions to sportsmedicineweekly.com. That's our website, and click on the homepage, and you'll see our picture there, Dr. Cole and I, and underneath our picture, you can click on the link and ask your questions. What about shoulder instability, Dr. Nicholson, for this week? And I know you guys are doing a study, so I'm going to kind of put one question together with another topic here. The incidence of shoulder instability, dislocations in high school football. I understand Midwest Orthopaedics at Rush currently performing a study to determine risk factors if there is a dislocation. Here's the question. What is the risk of further instability? Finally, the proper treatment for dislocations.
Well, it's a great question, Steve. And also, here we are in high school, college, and pro football season. The shoulder has the least amount of bony stability in the body, and it is the most commonly dislocated joint in the body. Now, you can have a dislocation, which is the ball comes out of the socket and stays out, or you can have a subluxation, which is, you can think of it as a partial dislocation. Might come out quickly and come back in. Both of those things create ligament injury. So you can think of a shoulder dislocation or subluxation as the ultimate sprain. Once it starts happening a lot more. In the orthopedic literature, the epidemiology would say if you've had your first traumatic dislocation under the age of 19, the chances of you coming out one time or more again is 90%.
Wow.
If you're over 29, it's exactly flipped. Your chances of coming out again are 10%. So we have a high-risk factor population under age 19 playing contact sports with their arms out away from their body. The incidence, we don't know yet what the incidence or prevalence of recurrent dislocation in the high school football athlete is. We decided to look at contact sports, i.e. football, not rugby, not lacrosse at this point. We have over 40 high schools that we're monitoring, so we need to know the denominator. How many kids are playing, freshman, sophomore, junior, senior? And do we treat that athlete differently because they're a freshman, sophomore, junior, or is it his senior year? Also, is there increased risk by position? A tight end, an offensive lineman, a linebacker, a running back, those things we don't know. So we need numbers, and that's why we have over 40 high schools in 3 different states. So we're going to try to find out what that injury is, what the risk was, what happened, what were you doing, athlete, when it did happen? Was it practice or a game? Also, what we need is advanced imaging. Many, many studies in the past have relied only upon X-ray findings. We need to do a better job, and every one of those athletes needs an MRI so we can determine the extent of the injury, the zone of the injury, and then as that study goes forward, we can determine some risk factors. But it's gonna take us a couple of years for sure. But I think it's well worth doing, because think about it: if you tear your ACL, you're not going back in that football game and you're out for the season.
Yeah.
But if you dislocate your shoulder, it's like go back in and come back out when you dislocate again. Prove to me it's going to happen again, which may or may not be the right thing. Listen, we have a local athlete, Chicago Bear, dislocated his shoulder. The first time you do it, like we said, it's an ultimate sprain. So it may take 2 or 3 weeks for that to settle down. You get stronger, you feel stronger, you're better and ready to roll. Each successive dislocation, though, doesn't take as much and it doesn't hurt as much. So maybe you come back faster. And then what do you do in the off season? How do you treat that patient? So that decision to do surgery to stabilize that athlete may or may not occur. So that's the basis of our study. So if you're a contact athlete under the age of 19, your risk factor for recurrence is fairly high.
Great stuff. We're out of time. Appreciate it. Dr. Greg Nicholson, really appreciate you joining us the last 2 weeks, subbing for Dr. Cole last week and this week. Marvelous stuff. Thanks
Steve,
so much.
Steve, it's been a pleasure. Thanks so much.
That's Dr. Greg Nicholson from Midwest Orthopaedics at Rush, orthopedic surgeon, specializing in shoulders.
Shoulder and elbow.
Yeah, shoulder and elbow. Fantastic. All right, folks, we're going to wrap it up. Our producer, Shane Reardon, coordinating producer, Teresa Ann Seeger. Many thanks to David Cole for running our website and business operations, as well as Samantha Smith from Midwest Orthopaedics at Rush. For Dr. Greg Nicholson, subbing for Dr. Brian Coe, I'm Steve Cashel saying so long. Coming up next on The Score, Inside the Clubhouse with Bruce Levine. You've been listening to Sports Medicine Weekly only on 670 The Score.